Okay, so we had a lot of response, a lot of persons selected B. So what is the movement of filtered solutes and water from the lumen of the tubules to the plasma fluid compartment called? And this is reabsorption, so that's correct, okay? So when we move water or solutes, either of those can be moved across the barriers to filtration, remember those layers. When we move those substances from the tubule to the plasma, which is essentially inside the capillary, we call this reabsorption. And if you move it in the opposite direction, we're going to call that secretion, okay? And remember, filtration is only what takes place across the glomerulus. So the initial filtering of blood through the glomerulus, where it enters the first part of the tubule, that's what we call filtration, whereas secretion and absorption take place across the tubule and the blood vessels that are entangled with the tubules. Okay, not too bad. So the answer here was B, reabsorption. Let's look at another. Alrighty, 10 more seconds. I don't know if you guys can see the timer. Hopefully you can. Okay, so let's see. Okay, so we had a 58% of the class choosing A. So which of the following is the only substance reabsorbed in the ascending limb of the loop of Henle? And that is water, okay? So at the ascending limb of the loop of Henle, we kind of talked about this generally before, but we're gonna speak more in detail about it today. But the only substance that is reabsorbed in the ascending limb is water. It's impermeable to the movement of anything else except water. Okay, all right. And then let's do one more, or two more rather. So let's end this. Okay. Oops, I didn't change the question. Okay, so this was water, and let's look at a third one. Okay, final 10 seconds. All right, let's see. Okay, so we had some split between A and B. So the rate at which a substance is excreted is also known as what? So it's not going to be A or B, and that's what most of the response was for. The rate at which something is cleared or excreted from the body or excreted in the tubule is called the clearance rate, okay? And that differs from the transport maximum. Remember, the transport maximum is the rate of movement of substances across the proximal tubule at which all of the carriers have been saturated. So that is the rate at which we have maximum saturation of the carriers that are reabsorbing substances across that epithelial membrane. Glomerular filtration is not the rate at which things are excreted. It's the rate at which things are filtered from the plasma or the blood across into the tubular structures. So that's going to be kind of the opposite end of the spectrum from the excretion or clearance. So filtration is what comes from the blood into the tubular structures, and then clearance, the clearance rate or the excretion rate is going to be what leaves the tubular structures and then goes down to the bladder as urine. And then micturition we described as urination or the process of urinating. And so that has nothing to do necessarily with those renal exchange processes. Okay, so the answer here was clearance rate. We talked about a few different substances and their clearance rate. And remember, we said if the clearance rate of a substance is greater than the GFR, then that means it must be secreted. And if the clearance rate of a substance is less than the GFR, that means it must be reabsorbed. Okay. All right, let's look at one last question. All right, let's take a look at some of the responses. Okay, good. So we had an overwhelming response for B, and the question asked, which of the following substances has a zero clearance rate? And that is glucose. Okay, going back to that point that I just made, if something has a very small clearance rate, then it must be reabsorbed. And if it has a zero clearance rate, then it is fully reabsorbed. And we know that all of the glucose, 100% of the glucose should be reabsorbed under normal healthy circumstances, okay? Now this is not speaking about, so the answer here was glucose. So this is not taking into consideration things like diabetes. So diabetics do actually spill urine, spill glucose into the urine, and that's obviously because they have higher glucose concentrations. But under typical healthy circumstances, glucose has a zero clearance rate, and it should never appear in the urine. It should be absorbed 100% in the proximal convoluted tubule. And this is actually why we call diabetes mellitus. If you've ever heard the term diabetes mellitus, this is because the older way or the archaic way of diagnosing diabetes was actually to taste the urine. So the first physiologist would actually taste the urine of the patient that they suspected had diabetes, and if it was sweet, then they would know that there was spilling of this glucose into the urine. Okay.